I had a chance to sit down with one of the Clinton Global Initiative Greenhouse's inaugural class of social impact entrepreneurs and startups. Erica Plybeah and Nathalie Occean are the CEO and COO of MedHaul. This Memphis-based tech company provides low-income and elderly patients a safe and easy way to get to their non-emergency medical appointments.
So I'm Nathalie Occean. I'm the Chief Operating Officer for MedHaul. My background is, I'm originally from New Jersey, and my family's been in Memphis for about 10 years, which is where I met Erica when I was in grad school. But my background is in healthcare management and administration with a quality concentration, so I bring that lens to the company for Erica.
Amazing.
Yeah.
And I'm Erica Plybeah, founder and CEO of MedHaul. My background prior to this was in clinical and research informatics, which is essentially building software solutions for hospitals, clinics, academic research institutions. And I'm from Mississippi, the Mississippi Delta to be exact, and that has impacted a lot of my work.
That's amazing. And you started MedHaul? Could
Yes.
you tell us just what is MedHaul?
Yeah, MedHaul is an organization that helps healthcare providers like hospitals, health systems, pharma organizations understand and solve transportation barriers for their patients with the most vulnerable needs or their most overlooked populations.
Okay, is it maybe for someone who doesn't have a caretaker at home to take them to, is it like doctor's appointments or care facilities? Is that what it's for?
Yeah, so it could be a multitude of things. We typically say that we're building transportation solutions for folks with complex physical or social needs.
Okay.
So those are usually low-income patients, elderly patients, patients with disabilities, or even folks in rural communities.
And so where was it in your journey? Because I hear your academia story.
Yeah.
What was it when you were at your work or while you were studying that made you go, where is this? Where is this? Because I feel like entrepreneurship is you see a problem and you create a solution.
Yeah.
What was that problem? And does this happen simultaneously? Did it happen to one of you when you brought someone on? How was that?
Yeah, I'll let you go first and then I'll...
You'll corroborate her story if she's telling the truth.
Exactly.
Yeah.
So there were a few things. With my experience in clinical and research informatics, I spent a decade almost helping healthcare providers implement technology that can make a clinical workflow a lot easier, whatever the clinical workflow was, whether that is recruiting a patient for a clinical trial or finding a better way to document medications in a electronic medical record. And so I've always been obsessed with using technology to make a workflow in healthcare a lot easier. I fell in love with transportation because my grandmother was a type 2 diabetic, double leg amputee, and my family struggled tremendously with getting her to all of her doctor's appointments. My mom was my grandmother's primary transporter, but my mom is also a full-time teacher, so trying to juggle all the doctor's appointments with her work schedule. We did not have an easy way to find transportation for my grandmother, and she was a double leg amputee, so she was wheelchair bound. So it required a little bit more of like a specialized transporter because this would be someone that would be lifting her in and out of a vehicle, and it was just so frustrating, and it was weird because it was like this was back in early 2010s, 2013 or so. And we just thought, like, in this day and age, there would seem like there would be an easy way to do this, especially because Uber and Lyft were around. Yeah. This was my family in Greenwood, Mississippi. Okay. So I just thought, hey, this is just a problem they're having in the Mississippi Delta. Clearly, this happens nowhere else. Like, nobody else across the country is having this
Definitely
issue.
not.
And it wasn't until I was working for a health system in Memphis that I saw the problem from the healthcare provider's lens.
Okay.
So they needed to discharge patients who may have been disabled, or a patient that may live in a rural community, but that patient didn't have anyone to pick them up, or that person that would be picking them up didn't have the appropriate vehicle to transport them. And so this meant that the patient may even need to stay overnight just because they don't have a ride. And those are extra costs for the hospitals. Yeah. And so I was like, this is kind of like the reverse problem of what my family was having. Like, I didn't even think about it that way. And then as I started to ask other healthcare administrators, I have a lot of friends and colleagues that are healthcare administrators, so directors or CEOs, COOs of hospitals or medical facilities. And I just started to ask, like, hey, what issues are you having with transportation? And they're like, oh my God, let me tell you about all the issues we're having. It takes too long to find a transportation provider. We're spending time on the phone. Even when we book the ride, there's so many errors. They show up at the wrong time. They show up at the wrong place. They don't bring the appropriate vehicle. And I'm like, well, how are you booking the rides? They're like, we're just calling, So the booker, which is usually like a nurse, a clinical social worker, they're looking at a different set of data than the transportation company. There was no mutual portal that the two parties were looking at. And so that is one area there that creates manual errors just are a thing with humans, and it's perfectly fine. But my wheels started turning, and I'm like, how can we make this a lot easier? So that's a long story, but it started off as a personal issue that my family had. I was very familiar with building technology for healthcare providers. I understand how healthcare providers think. I understand the workflows. I understand the challenges of implementing technology in healthcare settings. And this was something I wanted to build for my family. And then I learned that hundreds of millions of folks also face the same problem across our country. And so I'll go ahead and let Nathalie share.
Yeah, so with all of that, I was always on board with Erica's idea before the company even got started. But with my background in the academic medical center environment, because that's typically where I was able to practice. I'm not a clinician, but perform my work as a hospital administrator. And I saw a lot, especially working in the quality sector, where we talk about patient safety and risk, and how do we kind of manage and make more efficient the discharge process, like Erica was speaking to. We saw a lot that transportation kept coming up. And I also worked for an organization that provided transportation for their patients through the Medicaid benefit that the patients have. So again, seeing what already exists and learning about the problem to the extent of I didn't realize how many millions of families like Erica's were dealing with this issue, what that meant for the organization, what that meant for the patient clinically and financially, as far as what they'd have to contribute to kind of addressing this barrier. So I've always been a proponent and an advocate of access to care, and how do we eliminate disparities, address the disparities, call them what they are, and provide solutions that'll help fix them. And this is just one, it feels like such a big piece, but it really is just one small facet that we're hoping to make a ripple.
And what was your meet cute? What was your little meeting story? How did you two meet?
Yeah, so when I was in grad school, we both were part of a healthcare association, so a National Association of Health Service Executives, NACE is the acronym. And Erica was already on the committee, but I was still in grad school. So I was coming in from the perspective of the student. I did a case competition. Annually, they have a conference, and a case competition is part of that conference. And I competed, and the team at Memphis, and Erica was like, oh, whenever I get a team, I want you to be on it.
Nice.
I was like, I don't know what you're talking about. I don't know what kind of team.
It's called identifying talent, right? You're like, she's got it.
Right.
I need her, and that's how it's going to work.
And we served through this organization, NACE. We served on a committee for scholarships. We have a partner that provides scholarships to minority students pursuing a career in healthcare.
That's incredible.
And just Nathalie's work ethic, I was just like, she was just so committed to getting things done. And those are the folks that I work well with. This is hard work.
Yes.
It is, it's for the greater good. But this is very hard work. And we need folks who are very high performance. And I was just always obsessed with Nathalie's work ethic. And at that time, I had no idea I would ever start a company. I was thinking like, if I have a team at a hospital, like I would recruit her. I'm like, I would want her on my team. This was like 8 years ago.
Wow.
So way before the company even started.
I could feel the trust between you two.
Oh yeah.
Can you guys read each other's minds without talking?
Yes.
You're sitting at me and you're like, you're no. Anyways, thank you so much. That was just like a little snippet. I want to continue this conversation. And
At Global Partners for Development, our mission is to advance community-led initiatives that improve education and public health in East Africa. We envision a world in which every East African community has the capacity to implement dynamic, sustainable solutions to the challenges they face. To learn more, visit gpfd.org.